Good morning to you, Minister Feehan. The Minor Ailment Scheme is an internationally recognised extended pharmacy service which allows pharmacists to improve the public health access, shape further future services and broaden pharmacy roles to deliver patient care and improve health outcomes. At present, private patients who want to access non-prescriptive medicines for ailments such as hay fever, migraines or skin conditions consult with the local pharmacist on the best options for them and pay for the over-the-counter medications. However, medical card patients with the same ailment can only access the same medication if they visit the GP and get a prescription. If, Minister, you could introduce the Minor Ailment Scheme, public patients would no longer have to make GP appointments, saving time for both the GPs and the patient. Pharmacy-based minor ailment schemes have been introduced throughout the UK to reduce the burden of minor ailments on high-cost settings, including general practices and emergency departments. 24 million consultations take place in Irish general practice each year, and over 1 million consultations by the out-of-hours co-ops, with Irish GPs receiving $551 million from the HSE in 2017. This implies a cost of $22.98 per consultation. Independent analysis commissioned by the IPU estimated that the full implementation of a comprehensive minor ailment scheme would save almost 1 million GP consultations per year and free up approximately 22 million worth of valuable GP capacity in an overloaded GP service, the equivalent of almost 100 full-time GPs. Minister, I've pointed out before that over 500,000 population live within 1 kilometre of a pharmacy and 85% live within 5 kilometres. So, Minister, why the delay? In 2006, the IPU submitted a submission to the Department of Health and Children on the pharmacy-based minor ailment scheme. January 2009, the IPU proposed the introduction of a pharmacy-based minor ailment scheme at a meeting with the Joint Oireachtas Committee on Health and Children. 2015, the IPU centred their pre-budget submission on a proposal to introduce the minor ailment scheme. To April 2016, the Minister for Health, Leo Varadkar, announced the introduction of a pharmacy-based minor ailment pilot scheme at the IPU's conference. July 2016, the pilot scheme commenced and runs in 19 pharmacies in 4 towns, Kells, Roscommon, Macroom and Edenderry, and will last for 3 months. May 2019, the Minister for Health, Minister Harris, addresses the IPU members at the IPU conference, declares, "We know the minor ailment scheme works. I'm fed up hearing about evaluating the minor ailment scheme. We know it works." May 2021, in a video address by IPU members, Minister for Health, Stephen Donnelly, states, "I also wish to emphasise the important role community pharmacists play in the wider health service in the delivery of holistic patient care. I am committed to further developing that role in the context of health service reform. I have listened to and met with the IPU, both in opposition and since I was appointed Minister for Health, and firmly believe that there is much merit in the initiatives you are seeking to progress as the minor ailment scheme." Minister, very often in this House we do a lot of talking and very little doing. This scheme works and will support our existing delivery of health care to our citizens.
Thank you, Senator. Minister, you've got 4 minutes.
Thank you, and I want to thank you, Senator Keogan, for raising this important issue today and for giving me, on behalf of the Minister for Health, the opportunity to clarify the position in relation to the introduction of a minor ailment scheme in community pharmacies. The programme of government contains a commitment to expanding the role of community pharmacies in managing patient health, and there have been a number of proposals in recent years to expand clinical pharmacy services, which you outlined. These include recommendations to the Pharmaceutical Society of Ireland's 2016 Future Pharmacy Practice Report and proposals from the Irish Pharmacy Union and others. And in addition, it is intended that a modernised service contract will include improvement and expansion of pharmacy services for public patients. Important new services in influenza vaccination and emergency contraception have already been introduced in recent years, and We see ourselves where I can go now to the community pharmacy myself for influenza vaccination, and it's certainly of great benefit. The Minister acknowledges that community pharmacists have played a huge pivotal role in responding to the health needs of the public during COVID-19 crisis, including most recently assisting with the vaccination rollout, which only happened last week. And I haven't data on the success of that, but it's very, very welcome. In order to be funded by the taxpayer, new public health services in community pharmacy, as elsewhere, should address unmet public health needs, improve access to existing public health services, or provide better value for money or patient outcomes. Any new or transferred services should also be based on sound evidence, with matching improvements in governance and administration. One such proposal for an expanded community pharmacy is a paid minor ailment scheme, where pharmacists treat medical card patients directly with over-the-counter items for specified minor conditions without the patient needing a GP prescription. And it has been suggested that such a service will produce better patient outcomes and reduce GP consultations for GMS patients with minor conditions. Pharmacists already provide the services for private patients, and it is within their scope of a professional practice. And as you rightly outlined, that the HSE undertook this 3-month feasibility study in Kells, Roscommon, Macroom and Edenderry. And there was 5 conditions. There was dry skin, dry eyes, vaginal thrush, scabies and threadworm were selected, with clinical protocols in place for safe and accountable practice. The pilot was intended to demonstrate the feasibility of delivering such a service, and the HSE report found its operations in terms of IT and claiming infrastructure was effective. However, and you rightly said, a larger trial with defined outcome assessment will be required to produce meaningful data on clinical outcomes, patients' experience and effect on GMS GP activity for minor conditions. Therefore, if this matter is to be progressed, more extensive trialling will be required to determine the effectiveness or otherwise of a minor ailment scheme in an Irish healthcare context. The Minister met with representatives of the Irish Pharmacy Union last December, where the minor ailment scheme and other issues were discussed. The Minister stated that he wants to see the expansion of the role of community pharmacists through a new contract in line with Sauncha Care objectives. And in this regard, it is intended that any discussions on progressing this issue will take place in the context of broader consultation with pharmacy representatives on a placement for the currency pharmacy contract.
Thank you, Minister. Senator,
Thank you, Minister. And as we rebuild our health service after COVID-19, we must remember the resources of community pharmacists and its value that we hold within the implementation of healthcare to our community. Changes were made to allow pharmacists to give the emergency contraceptive to women with a medical card. So the IT systems are already there. So the mechanism of how the minor ailment scheme would work, very little support for the sector would be needed to implement this. Minister, our delivery of community care services must be the only way forward. So I'm urging you to allow this vital piece of community-based recovery to be put on the long finger, and we can't continue to put on the long finger. Another larger trial, it's not what this industry needs. It's not what we need. The trial was already done. It was a resounding success in the 19 pharmacies, and indeed the data collected from that did justify that. So I'm urging you that while you're preparing this year's health budgets, and the costings for this must be included, the last thing we need here, again, is another trial. So this is a vital saving, and I do believe that it'll help the already stretched health service in this country.
Thank you, Senator Keogan, for raising this important matter today. And the Minister is keen to expand the role of the community pharmacists in managing patient health. And the Minister is also of the view that to be funded by the taxpayer, any new public health services in community pharmacy, as elsewhere, should improve health outcomes and provide value for money and benefits for patients. Any new or transferred services should also be based on sound evidence, which I think we have, with matching improvements in governance and administration. While the introduction of a comprehensive and resourced minor ailment scheme would require further trialling and consultation, it is the Minister's intention that a broader discussion with the Irish Pharmacy Union on contractual and service arrangement be carried out in due course. And we did see, I suppose, the Irish Pharmacy Union they have a very, very strong voice, and it's a voice I always welcome. But we did see, again, with the flu jab being available in pharmacies, how effective it was. But a lot of times there's probably issues in contract, and I'm sure they will be dealt with by the Minister and the various members, officials from the Department of Health and the HSE and the IPU. Thank you.